Well, we have consultant radiation and clinical oncologist, NSIA-LUTH Cancer Centre, Dr. Bolanle Adegboyega joins us on TVC News at 10. It's good to have you join us on the news. The World Health Organization, of course, released troubling statistics about cancer, saying that the number of new cancer cases globally will reach 35 million by 2050. What are the factors driving these numbers?
Oh, thank you. Good evening. Thank you for having me. So generally, there's a change in so many things: our diet, our way of life. Then people are not screening early. There's no access to care. And in Nigeria, some of us we believe in myth and misconceptions about cancer, thinking it's an arrow, it's an evil arrow, it's an attack. So people don't even present early. So these, among many factors, are responsible for the numbers going higher.
But if you take a look at the 3-year-long campaign that commenced in 2022 and will end this year, I'm talking about the Close the Care Gap, Everyone Deserves Access to the Cancer Care campaign. Where do you think we are now? Have we made appreciable progress?
Well, generally, I think we're getting better. We're not what we used to be, but there's still a long way to go. For instance, in Close the Care Gap, it has to do with both the patient, with the relatives, with the community, the environment, and the caregiver, and the access that we have to cancer care. So before now, there was a time that there was even no single working radiotherapy machine in the whole country. But for now, we have a number of functional centers, though it's still far less to what we're supposed to have. And then at least we have access to these latest advances in cancer treatment. Only that it is not affordable and it's far below what it used to be. Before, we don't even get patients that present early, but now we have patients that are coming in following cancer screening. So we are getting stage 1 cancer, we are getting stage 2 that we know that can still be cured if funds is not an issue. So we are moving closer, awareness is increasing, but the access and the affordability is a major one we are having now.
Of course, just like a majority of countries do not adequately finance priority cancer and palliative care services as part of universal health coverage, but what immediate solutions would you suggest to Nigeria's Minister of Health?
Okay, in the immediate, so I think now we have launched the cervical cancer campaign, though the uptake is a bit slow, but I think maybe we have to create more awareness such that cervical cancer is a cancer that is highly preventable. So if that is out of the way, then it's actually going to bring down the body. So now the major one will be the financing. So now health insurance, NHIS is taking, but most NHIS is not even covering cancer. Fine, the government is doing some cap initiative program so that some patients can afford cancer chemotherapy, but we need it to cover stuff like radiotherapy. We need more money into that. Then financial toxicity is a major problem with cancer. So government and NGO and individuals have to put in more funds into it. Now, in some cancers, we can even achieve care with some targeted therapy, immunotherapy, but it's far beyond the reach of an average Nigeria. Even an average Nigeria still cannot afford because it comes in millions of naira. So more funds has to be dedicated into it. More health insurance has to include cancer care into their coverage. And with that, at least it will still solve some issues.
Hopefully that will bring down the numbers, of course, the troubling numbers being released by the World Health Organization. Consultant radiation and clinical oncologist at LUTH Cancer Centre, Dr. Bolanle Adegboyega, thank you so much for speaking with us.
Thank you very much.